I always knew I wanted to go in the medical field per my father, who was one of the primary care doctors in the area. I got into University of Chicago for residency, which took 5 years. For my last year of training, I went out to Stanford University, where I worked in California with the San Francisco 49ers. I did practice in Chicago for a few years, working with some sports teams on the North Shore there, and I've decided to come back here to work with athletes and non-athletes here in the Erie area. With my background dealing with more professional athletes, I think you have to be on point, so to speak. So you have to understand their history, what their problems could be, and how to best deal with their expectations. Whether it's the 18-year-old athlete who now feels like they can't do their water polo sport or their football sport versus someone who comes in who's 60 or 70 who says, I have my grandchild's wedding coming up and I don't feel like I'm able to do the things I want to do at the wedding. You base your treatment plan on the risks, benefits, what's successful in your hands, and how to return those patients, whether they're the athletes or non-athletes, back to their timeline. If surgery is indicated for some patients, I would expect them to have a very good knowledge base of why they're undergoing the procedure, of what the risks and benefits of the procedure are, of how to make the decision themselves for something surgical, and then the outcomes overall, the long-term outcomes, in addition to post-operative care. So I'm pretty deliberate with them with coordinating care with local physical therapists and matching people up with expectations to make sure that they follow that algorithm. Many things in musculoskeletal care are non-operative, which is very important. As patients go along the non-operative route, whether it's activity modification, whether it's physical therapy, whether it's restriction from certain things that they like to do, as they become dissatisfied with some of that care, I then intercede with the ability to show them a roadmap. It's matching patients' expectations and their timeline on the timelines I know to be true with my training and my abilities. There's certain things that we're bringing here to the Erie community, namely a little bit of better understanding of hip-related problems in younger athletes. We're trying to do more with advancing the knowledge base of making athletes return back to their athletic competitions in a safe manner. Patients teach me all the time. They come in with their stories, with their abilities, with what they like to do, with how they do non-surgically, with how they do surgically. They do share their stories in a way that I can then better grasp and treat other patients along the way by listening to the patients I have now. Hands down, the most gratifying part about working with my patients is seeing them meet their goals. When patients come in to see me, I usually ask them quite candidly, give me 2 or 3 goals that you'd like to return back to, or what activities are you missing because you're having this problem? And they tell me, my assistants in the clinic, that they're going back to doing those goals, or they're featured in the newspaper. I think that's the most gratifying part, to kind of watch that process. What differentiates me from perhaps others in the region, based on experience and based on training, I think it's the one-stop shop. I think you're looking for someone to help coordinate all facets of your care. As Erie in general is kind of undergoing this revitalization, it's important to look to the medical field to say, how can the medical field also improve that for the Erie community? And we're making very good efforts on doing that just by having the outside training to kind of bring back to the area to make people do better.